I'm Lyra McGuire, and this is my head-to-toe assessment for Maryville University. I'm going to ask my patient Kathy to enter the room, and prior to her entering the room, she emptied her bladder, placed the gown on, vital signs were performed and assessed, and her distance vision with the Snellen test was performed. So I'm going to start with the head and face. I'm going to be inspecting and noting for any skin lesions, discoloration, and noting for the symmetry of the eyes and the ears, pulling the hair back to note the ears position, and then I'm going to move on to palpate the skull. And while palpating the skull, I also will be assessing the hairline, noting for texture of the hair, distribution of the hair, moving from the front to the back. The skull, the skin on the skull should move freely, and there should be no masses or lesions. Then I will move on to palpate the facial bones, starting with the frontal bone. Again, there should be no masses, no pain, no tenderness. Moving on to the zygomatic bone in the cheek region, and onto the xiphoid bone in the temporal area. While I'm here in the temporal area, I can also palpate the temporal artery, noting that it's equal and bilateral on each side. And moving on to the sinuses, I will be assessing the frontal and the maxillary sinuses. The frontal sinuses, also noting for pressure, pain, and the maxillary sinuses, again, for the same, pressure or pain or discomfort upon palpation, and none are noted. Now I'll be testing some light sensation of the facial cranial nerves, and this tests the trigeminal cranial nerve sensory function. I'm going to swipe this across the patient's forehead, the cheek, on both sides, and the chin, and then rotate out a different object, the cheek, the forehead, the cheek, and the chin, and ask the patient if they notice any difference in the sensation, and determine if there is a difference in sensations on either side or with the objects. And now I'm going to continue testing the craniofacial nerves by having the patient, can you clench your teeth for me? And can you squeeze your eyes shut? Can you wrinkle your forehead? And can you smile really big? Can you stick out your tongue and puff up your cheeks? And again, noting for symmetry or differences on either side of the face or weaknesses. Now I'm going to move on to the eyes, and I'm going to do an external examination of the eyelids, noting for any crusting on the eyelids or redness or inflammation. And noting that the eyelashes should be curved out and away from the eye. I'm now going to inspect the sclera conjunctiva and note for the color and for erythema. I'm going to have the patient look up and note, no, looks clear, and look up on this eye, also looks clear. I also don't see any exudate. I'm going to palpate now, and I'm palpating for the lacrimal apparatus, which is in the lower orbital rim near the inner canthus, and no masses are noted, no exudate is noted. Now I'm going to ask you to cover one eye with your hand. You can lift that up, and I'm going to move my fingers in and tell me at what point you observe my fingers.
No.
Okay, and alternate hand with the other eye, and tell me at what point you observe my fingers. Okay, so peripheral vision is intact. Now I'm going to assess pupillary response with direct and indirect response, direct and indirect response. Okay, I'm going to also have you close one eye and focus on me, and I'm observing the eye for any movements. Now, take your hand down, and I'm also observing the covered eye as you focus in on me for any movements. And repeat on the other side. Focus on me, and take your hand down, and observing the other eye as you focus for any extra movements. And to continue examining the extraocular eye movement for nystagmus, I'm going to have you follow my finger through the horizontal plane and the vertical plane. So just follow my finger, and no nystagmus noted. No nystagmus noted on this side. And continue to follow my finger. And no nystagmus noted. Okay. Now we're going to move on to inspecting your ears. And I'm going to start with just inspecting the alignment on either side. Okay, and I'm going to inspect the auricle, noting for tenderness, noting its position on either side. No masses, no discharge, no cysts or lesions found on either side. And now, and they are firm and movable. No pain noted whenever I palpated those. So now we're going to move on to the whisper test. And what I'm going to do is I'm going to stand 2 feet away from you on this side and ask you to plug your ear on the opposite side. I'm going to whisper some letters to you, and I would like you to repeat them as you hear them. 3, T,
9.
okay? And if you could repeat the same on the other side. 3, T, 9. Okay, great, thank you. And now we're going to do, with our tuning fork, which I don't have a real tuning fork, but we're going to utilize the tweezers at the moment. And we're going to do air versus bone conduction. And starting out to find out if she can hear the vibrations in both ears equally, I'm going to engage the tuning fork and place it in the midline vertex of the head and ask if you can hear it equally on each side, the vibrations.
Okay.
Can you hear it?
Yes.
Yes. Okay, so now we're going to move on and do air versus bone conduction on each side. And again, I'll engage the tuning fork and place it behind the ear and ask for you to say when you stop hearing the vibrations.
Stop.
And I'll move it to the front of the auditory canal and ask again for you to say when you stop hearing the vibrations.
Stop.
Okay? I'm going to repeat the same on the other side.
Stop. Stop.
Okay. And air conduction should be twice as long as bone conduction, and it was. So now we're going to move on and assess your nose, and I'm assessing first by looking and noting for symmetry, if it's midline, if there's any deviations, if there's any lesions, the color, texture, also noting for any discharge. Then I'm going to ask you to plug one side of your nose and breathe in, and do the same on the other. And this demonstrates that you have patent airway. So now I'm going to observe internally inside your nostril with the flashlight. If you could just tilt your head back. So now I'm observing the mucosa. It is pink. The septum is midline. There's no deviation. There is a nice clear film, and everything looks appropriate. And the turbinates are pink and firm. So now I'm going to move on to your mouth and your throat. So first I'm going to take a look at your lips. They look symmetrical. There is no masses externally or abnormalities noted. And if I palpate, is there any tenderness? No? Okay. So now I'm going to have you open your mouth, and I'm going to take a look at your oral area. So the buccal mucosa looks pink. Teeth are intact, no missing teeth. Tongue is a dark red or a dull red. Throat uvula is midline. Tonsils are intact, no redness, no erythema. Can you stick your tongue out for me? Can you lift it up? No lesions or anything on either side or underneath the tongue, which is the first sites of where you would see oral cancer. Also, I'm going to look at the palate of your mouth. Can you open your mouth one more time as well? No lesions indicated on the palate of the mouth. No erythema. Everything is intact. Okay. Now I'm going to move on to your neck. I'm going to palpate your trachea to see if it's in a midline position. So your trachea is midline and looks good. Now I'm going to have you swallow some water. Just if you could take a sip first, and I'll let you know when you swallow. Okay. And I'm going to feel down as you swallow. Go ahead. In your thyroid, no nodules noted, no enlargement noted as she swallows. And as we continue on, I'm going to listen to your thyroid with my stethoscope and see if there's any brutus. So now I'm going to assess your lymph nodes, and I'm going to start with your preauricle and your post-auricle, and then your occipital, and your tonsillar, and your submandible, and then your submental, which none are enlarged. And then I'm going to move on to your, following the sternal clitomastoidal muscle, and in the front is the anterior clavicular or the deep clavicular nodes, in which there's none inflamed, and then posterior cervical nodes, again also none inflamed. I'm going to have you relax your arms to the side. And now I'm palpating along the supraclavicular nodes, along the clavicular line, and noting if I feel any. And no swollen nodes are noted. And now I'm going to auscultate the carotid artery after palpating on either side. And both sides are bilateral. Okay. No bruise noted. Now I'm going to inspect your upper extremities. So if you could hand me your arm, I'm going to look at the dorsal and the palmar areas of your hand, and also note for your fingers, note for completion of the digits, note for any swelling in the joints or tenderness in the joints as I palpate along these joints, which there's none noted. So on this side, note for any skin color, temperature, any lesions, any tenderness along these joints. And now I'm going to assess range of motion. If I can have you put your arm out at a 90-degree angle, and if I can have you flex your wrist down and hyperextend your wrist up, okay? And if I can have you also stick your hand out and bend your fingers at your knuckles for a 90-degree angle, yep, and back up. And then abduction of your fingers, and then back in. And then if we can do your wrist, you can do radial and ulnar. And same on this side. If you can extend your hand out and bend at 90-degree angles at your knuckles. And then also your wrist, 90 degrees, flexion, hyperextension, and abduction of your fingers, out and in. There we go. And then range of motion of your wrist, and radial. Okay, there we go. Okay, so now I'm going to move on, and I'm going to assess the pulses. And I'm going to do your radial pulse on either side. And I'm going to do your brachial pulse on either side. Okay. Also, while I was inspecting the fingers, I also would be inspecting the nails for chipping, flaking, discoloration on either side. And we can move on and do your axillary nodes. So I'm going to follow the axillary line down. I'm feeling for your nodes, which there's no enlarged nodes on this side. And no enlarged nodes on this side. Okay. And then I'm going to have you turn in the chair this way with your back facing this way. And I'm going to assess your shoulders, noting the symmetry of the shoulder blades. And I'm going to raise your arm and note for any pain when this is raised. And then additionally on the other side. And raise and lower. And any pain?
No.
And I'm palpating along the shoulder blades, and noting for any tenderness or any masses. And while I'm here, I'm also going to assess her back and her posterior chest. And I'm going to follow the scapular line and note for symmetry of the spine. And here's when I will do some percussion along the scapular line to locate the lower borders of the lungs. So I'm going to have you bend forward a little, and I'm going to, noting for the dullness. Okay. Okay. So now I'm going to also have you, we're going to examine your diaphragmatic excursion, and I'm going to have you take a deep breath and hold it. Okay. And then take another deep breath. Okay. All right. And then I'm going to have you take a few deep breaths in and out, and then exhale and hold it. Ready? Okay, go ahead and exhale and hold. Okay. And go ahead and relax your air breath. Okay. And on to the next one. Take a deep breath and exhale and then hold. And this marks the distance of the diaphragmatic excursion. Okay. And as she's here, I'm going to also palpate down and ask her to take a deep breath and note for expansion of the chest. In and out. Okay. And then I'm going to ask you to say 99.
99.
And
99. 99.
Okay.
99. 99. 99.
And that demonstrates tactile fremitus in the posterior chest. And now I'm going to ask you to turn back this way, and I'm going to inspect your lungs. I'm going to need you actually to lay down on this one. Okay. I'm going to first note the expansion of the chest as you take a deep breath in. And again, I'm going to pull this down a little. And I'm going to have you say 99.
99. 99. 99. 99.
Okay. And I'm noting the skin for any crepitus or subcutaneous crepitus. And I'm noting for the sternum to be midline and no deviation to one side or the other. Okay. And then I'm going to listen to your lungs. Can you take a deep breath in and out? In and out. In. Out. In. Okay. And I'm going to have to go on the side here, laterally, and in, and out. And this side, in, and out. Okay, if I can just have you sit up, you can sit up on the edge of here. I'm going to listen posteriorly as well. Take a deep breath in. In, and out. Laterally on either side. And lungs sound clear. Okay. Now I'm going to have you raise your arm on this side, and I'm going to do percussion down the lateral side of the base of the lobes of your lungs. Okay. All right. And then as well on this side. now I'm going to examine your heart, and you can also return to a lying position for this. Okay, I'm going to start by examining and feeling for the apex of the heart. So I'm going to come down here. So I'm feeling for the apex of the heart here in comparison with the carotid artery. Okay, now I'm going to examine the precordium, feeling here at the apex and left of the mid-sternum, and then at the base, and noting for any thrills, bruits, or any abnormalities, and none are noted. Okay, now I'm going to listen to your heart sounds. And the apex of the heart again. And no palpations, no abnormalities, no skipping beats were noted. Now we're going to move on and do the inspection of the jugular venous pressure. And I'm going to have you lay supine, so I'm going to take the pillow out from behind you and lay completely flat. And I'm going to pull this down just a little so I can assess the jugular vein, and I'm going to slowly increase your height up to a 45-degree angle, noting for when I can actually assess or visibly see a pulse within your jugular vein. Okay, I'm going to lift your head this a little bit and place this pillow underneath you. And then a pulse is noted. So now, if I were to measure your jugular vein pressure, I would have a ruler, and I would have a horizontal ruler at the apex of the heart, and take an additional ruler and do it vertically at the position where you can visibly notice the jugular vein pulse. And this measurement, this number here, will then be divided by 1.3, and that would give me my jugular vein pressure. Okay, now I'm going to move on to the abdominal inspection. And I'm going to first lift this gown, and I'm going to inspect for characteristics, any lesions, skin discoloration, hernias, any abnormalities, masses, or anything noted. Then I'm going to auscultate all quadrants for bowel sounds prior to palpating anything. Now I'm going to auscultate your arteries. So I'm going to do from mid-clavicular line, your aorta, so it would be to the left side of the mid-clavicular line for the aorta, and then slightly to the right side for the renal, and then slightly under the umbilicus for the right iliac artery and the left iliac artery, and then the femoral artery, your right femoral, and your left femoral. Now I'm going to percuss over all the quadrants just to assess sound and determine the difference between the domus and the tympani, which would be the sound of the air in the abdomen. Okay. Now, if I'm going to assess for the spleen, or the margins of the spleen, and that's going to be from the mid-clavicular line to the left side, And I'm going to percuss for the dullness of the spleen. If you make particular line and starting here, I'm working my way out laterally. Okay, and so that would be the border of the spleen. And then again for the liver, starting to make clavicular line in the base of the resonance of the lungs. Okay. Now, for the right and left kidney, if I could have you again sit up one time, and you can just turn towards the it. There you go. Mm-hmm. Mm-hmm. And at the base of the lungs, just here above the kidney, I would percuss. You should hear a thud on the right side. And on the left, and there should be no pain or discomfort with that. Okay?
Okay, back up.
Mm-hmm. You can go ahead and get it. Now I'm going to do some light palpation, which is no more than 1 centimeter in depth, feeling for any masses or discomfort, and feeling for the borders of my liver and spleen. Any discomfort? The border of the spleen would be on left. And also I can feel the aorta, which is slightly to the left midline, using deep palpation. And I would press deeply and feel for a pulse. And then you can also, with your deep palpation, feel the edges of the abductus rectum muscles. Okay. Any pain?
Mm-hmm.
Okay. Okay. Now I'm going to move on and assess your legs and your feet. I'm going to start with your feet. I'm noting for hair distribution, any masses, or the color, the temperature. I'm going to be feeling the dorsolateral pulse, dorsal pulse, posterior tibial pulse on either side. They're equal and present. And I'll be also assessing popliteal pulse on either side. Which is present. And noting for any pain or discomfort as I palpate, noting for swelling in the knee or any discomfort on either side. Any pain or discomfort?
Mm-hmm.
Any pain or discomfort when I assess the calf muscles?
Nope.
Okay. Then I will have the patient push down with her foot on my hand as I apply resistance to note for strength. Okay. And equal on each side. And now don't let me push you as I pull. There we go. And equal on each side. Okay. And now we're going to move on. You can sit up if you'd like. We're going to move on to the musculoskeletal system, and I'm going to do your brachial reflex. I don't have a reflex tool, but I will just verbally describe what will happen if I were assessing that. So to do your brachial reflex, I would have your arm flexed at a 45-degree angle, and have you resting your arm here on mine, with your palm partially pronated, and I would use my reflex hammer and about 1 to 2 inches above the wrist tap on the brachioradial tendon, and then with that reflex you should see that the elbow and the forearm should pronate and the elbow should flex, and that will indicate the brachial reflex. And so now to move on to the knee reflex, I would have you sit here. You might have to move to the chair because you're a little taller. And I would have my hand here so her knee is not resting on the back of the chair. And again with my hammer, right at the popliteal area, would apply pressure with my reflex hammer, and the contraction in the quadricep would cause extension of the leg. Okay, and you have back the seat back over here. Now I would do, you can just stay sitting up. Now I would do the Achilles tendon, and again with the legs at the 90-degree angle, I would rest my hand on her foot, and I would apply pressure here at the ankle medallion or the Achilles tendon, and it should cause a contraction in the plantar fasciitis, and that would indicate the reflexes. Okay. Now I'm going to do some muscle strength. So when I apply pressure here, I want you to push up with your knee. There we go. Okay, good. All right, now for this portion of the exam, you can just be standing. Okay, and I'm going to do some exam of your muscles and neck and your cervical area. So I'm going to extend your head forward, chin to the chest, note for any pain or discomfort. Extend back, note for any pain or discomfort. And now to the side, any pain or discomfort. You should be able to extend to about a 30-degree. And rotate your chin to the shoulder, and this chin to that shoulder. That should be about a 70-degree rotation. Now, as I apply pressure here, you pull your head to your chin, and I apply pressure. Okay. The same for the back. Push your head back. There we go. Okay. The same. Push your head sideways. There we go. And she has equal force or equal strength on all sides. Okay. And now I'm going to do your lumbar region. And your lumbar curve should be concave, and your knees and feet should align with your trunk. So I'm going to have you turn this way, and I'm going to palpate along your spine, noting for any tenderness or discomfort in any of this region. And then I'm going to have you bend forward to try and touch your toes, and noting for the curvature of your spine. Okay. And then I'm going to have you bend to the side, and noting for any discomfort, and bend to the other side. Okay. Okay. And that concludes our exam. And thank you very much for taking the time to participate in my assessment.
Thank you.
Mm-hmm.